not all of us were bad. A lot of us are good, and a lot of us just don't know any better. Just being pushed down. You know, like when you go to a water park and you get into these water slides, it only takes you one direction, doesn't it? Like, try as you might, you can't get out of that water slide. Like, it ain't happening. You're just getting funneled down, right? Until you come out of the swimming pool. It's like that when you get into the NHS, right? You're in debt, coming at med school, you have to go on courses and do research and present meetings and work and impress the bosses. Still in debt, lots of debt. Wait until you become a consultant or GP partner so you can start making some decent money, maybe a bit of private work, maybe a bit of medical legal work, pay off your stupid goddamn debt, start a family, buy a house. It's a funnel, constantly funneling. And then you've got these guidelines and protocols and managers and expectations. It's a funnel. You're funneling. So like some of my colleagues, junior consultants, they're like me in debt, want to start a family, just provide for themselves, do a good job, and they've been taught, do this operation, do a knee replacement. And you look at the x-rays, got severe knee arthritis, you can do a knee replacement, you can have a happy patient. Great. Knee replacement, hip replacement. But none of us have actually been taught anything about nutrition, about sleep, how to be healthy, how to naturally prevent or treat conditions. So it's not that we're all bad. It's just a lot of us are ill-informed, misinformed, uninformed. But then you've also got perverse incentives. So your insurance company, 20 years ago was paying £200 for a consultation. Now it pays £100. With inflation, 20 years later, it's half the price it was 20 years ago. So if with inflation, that £200 consultation should be £400 now, at least £500, but it's £100. And if you think about where house prices have gone in 20 years and cost of living in 20 years, so these consultants like me who saw their bosses when they're younger raking it in, living a lavish life, one partner working, kids private school, ski holiday in the winter, summer holiday in the summer. Now, as a consultant, you're living in a 2-bedroom flat and your partner's a consultant and you're a consultant and you can't pay for private education. You can't fucking afford these expensive holidays. You're thinking, what the fuck? What have I done wrong? What have I done wrong? Why can't I have that life that I saw my senior colleagues have when I was a student? I don't get it. And then, so then when, you see a patient and the insurance company is like, yeah, don't bother seeing them 20 times. We're only going to let you see them 3 or 4 times. First time you might see them and say, yeah, we could do this operation. Second time, you do the operation. Third time you follow them up after the operation. Fourth time you discharge them and you operate on them and you get more money for operating on them as well. The insurance company is happy because you've only done a few consultations and a quick operation or injection or keyhole surgery. They don't want you spending time with patients and multiple follow-ups and long-term they don't want any of that shit. They were like, quickly just decide what you're going to do and do it and then discharge. So there's all these, and it's in the same in the NHS. You can't follow up patients. Patients are coming to you pre-packaged out in the musculoskeletal system. So you get told this patient's got knee arthritis, see them in clinic, put them on the waiting list and then operate on them. So you've now become a technician. You're not diagnosing. I mean, a lot of my colleagues don't even examine their patients. So they just go by the diagnosis that someone else has made.
Yeah.
A physio, a GP or whoever. So yeah. And the thing is, like I said, because you don't ask questions, you just pile them high, churn it out. Quality goes down. You're busy. You're frazzled. You've got a clinic of 50 people. Are you just going to just go, all right, fine. Right. You got knee arthritis. You want knee operation? Okay. Yeah. Right. I'll take you. Okay. Bye. Sign this. Goodbye. Because that's the only way you can get through 50 people in a day. But if you actually go, oh, I see you've got knee arthritis. Is that the real problem? Tell me about your story. When did it start? What's your sleep like? Have you got mental health issues? You've got stress, because stress and anxiety and poor sleep amplify pain. Is it really surgery you want? Have you noticed anything in your diet? Could that be optimized?
Thanks for watching this video. And if you want to catch the entire episode,
head on over to the Radical Health Rebel podcast, where you can subscribe by scanning the QR code on the screen.